Why is my child struggling to breathe with bronchiolitis? Imagine your child trying to breathe through a tiny blocked tunnel. That's what happens during bronchiolitis, a viral infection that targets the smallest airways in the lungs called bronchioles. When these bronchioles get infected, they become swollen and fill up with mucus. This swelling and mucus buildup make the airways narrower, which makes it much harder for air to flow in and out of the lungs. As a result, your child may start to struggle to breathe. The difficulty in breathing happens because the inflamed bronchioles decrease the space available for air to pass through. The more swollen they are, the more resistance there is to airflow. Plus, the mucus that fills these tiny airways acts like a clog, further blocking the passage of air. When your child tries to breathe, they have to work much harder than usual. You might notice signs like rapid breathing, which means they are trying to get enough oxygen. They might also make a high-pitched whistling sound called wheezing, grunt with each breath, flare their nostrils, or see their skin between their ribs or under their ribs pull inward, which is called retractions. In serious cases, because less air is getting into the lungs, the oxygen levels in the blood can drop. This can cause the lips, face, or fingertips to turn bluish, which is a sign that your child needs urgent medical help. Usually, bronchiolitis begins with cold-like symptoms such as a runny or stuffy nose, a mild cough, and sometimes a slight fever. After a few days, the infection causes the small airways to swell more and produce mucus, leading to more noticeable breathing problems. Because breathing is harder and faster, infants and young children might also have trouble feeding. They may find it difficult to suck and swallow, which can lead to dehydration if they are not able to take in enough fluids. Parents should watch out for signs that breathing is becoming very difficult. If your child is breathing faster than 60 breaths per minute in infants, or if they are struggling to breathe or cannot speak or cry properly, it is time to seek medical help. Other signs include skin pulling in under the ribs or between the ribs, wheezing or grunting sounds when breathing, bluish coloring of the lips or face, and extreme tiredness or weakness that makes it hard for them to wake up. Most cases of bronchiolitis are caused by a virus called respiratory syncytial virus, and it mostly affects children under 2 years old. While many children recover at home with supportive care like keeping them comfortable and ensuring they stay hydrated, some children, especially very young, premature babies, or those with underlying heart or lung conditions, may develop severe symptoms. These cases might require hospital care to give oxygen, fluids, or breathing support. There is no specific antiviral medicine for bronchiolitis, so treatment focuses on helping your child breathe easier and stay hydrated. Sometimes, hospital treatment is needed to provide oxygen or assist with breathing if symptoms become very serious. Remember, every child is different, and their response to the infection can vary. It's always best to consult a healthcare professional if you are worried about your child's breathing or overall health. In summary, your child struggles to breathe with bronchiolitis because the infection causes swelling and mucus buildup in the small airways, making it hard for air to move freely. This increased effort to breathe can lead to lower oxygen levels and symptoms like rapid breathing, bluish skin, and fatigue. Monitoring your child's breathing closely and seeking medical help when needed can ensure they get the care they need to recover safely.